We have to have lawsuits because in litigation you get documents out from under seal that show that the companies have known about the risks. They have known about the risk of suicide, and it's really hard when you see in black and white the documents that show that they've known, and my husband's dead and countless of others are dead. On August 6, 2003, I received a call that forever changed the trajectory of my life. My dad called to tell me that my husband was found hanging from the rafters of our garage, dead at age 37. Woody wasn't depressed. He had no history of depression or any other mental illness. The greater the motivation a corporation has to shield its operation, the greater the need for the public to know.
Professor Schippers, may I ask you some questions?
Yes, of course. What do you want to know, Rico?
This conference is really about scientific freedom, but at the same time the deadly consequences of lack of scientific freedom. So I think that's very good shown. And I also thought this is a form of post-traumatic growth as a scientist, that you do something good for society to make sure it doesn't happen again to other people, what happened to you. So how do you think you can go forward with this, and how can we as a society change? Because the scale has grown tremendously, because now I think a lot of people notice something's wrong with the big pharma and something's wrong with all these things. How do you see that when COVID-19 happened?
Well, first of all, I will say I love that post-traumatic growth, because that is how it was really part of my healing. So the idea that as people and victims can't tell their story, or anybody, that is part of our healing. In whether COVID, whether it's your own being censored as a scientist, that is part of our being able to tell our story, right? And it's part of the conversation. I would say that what I've seen with not being able, it's just about having conversations. I'm going to go back to Ioannidis. Like, we should be able to have conversations. We should be able to, with different points of view. And I always say that this work that I do, you shouldn't have to learn the hard way what's really been going on. And even for a lot of people who've been harmed or potential harm, whether they're scientists or the politicians, why do they have to? And a lot of people change once it becomes personal. And sometimes the personal is what changes, but we should be trying to do it so we don't have to experience the personal.
Hi, Kim. I was really impressed with your talk. I read your story a few years ago and suddenly clicked, oh, that's you. That's the same person talking about your husband taking medicine, and a medicine that has a known history of suicidal side effects, let's put it that way. And and then it gave you, when you were telling your story, that you were fighting the company, or fighting for justice, basically. I got a feeling as a psychologist, okay, this is a form of post-traumatic growth, but it's after a trauma has occurred, you grow, but it's self-transcendent post-traumatic growth, because you want to make sure that other people don't get the same experience as you had. Is that a little bit correct?
Yeah, yes, that's absolutely correct. I liked your question that you asked in the meeting of post-traumatic growth, because I often refer to that as well. I had never, because of what happened to my husband, I felt like it was part of my own healing, doing and searching for justice, but also more importantly, I believe that it was, I just didn't want what happened to my husband to happen to anybody else. And it was also part of my healing. So I love that term, post-traumatic growth.
Thank you. So what you've done this for 19 years now? And that is a huge amount of time. How has that gone? Because I can imagine it has ups and downs, and sometimes you think you're fighting against David versus Goliath was one of the talks today. How is that for you?
Well, I have been doing this for 19 years. Some days I want to quit, but the reality is every single time I've gone out into the public, I will get an email or several emails of other families who are experiencing the exact same thing that happened to my husband, and I know that my time is not up because I want to keep doing it and fighting until the system is fixed. I like to call myself the accidental advocate. I never set out to do this drug safety work. However, sometimes the greatest purpose in life chooses you. 19 years ago, my life looked very different. I was happily married to my husband of 10 years, almost 10 years. I was traveling the world for fun and work and started talking about having a family. Woody wasn't depressed. He had no history of depression or any other mental illness. He had just started his dream job with a startup company and was having trouble sleeping. So he went to his GP, who he's gone to for years, and he was, because he was having trouble sleeping, and was given an antidepressant Zoloft for insomnia and told him it would help take the edge off and help him sleep. 5 weeks later, he took his own life. We never once questioned the drug. Why would we? It was given to us by our doctor. It was FDA approved, and it was advertised and promoted as safe and effective.
If I go to this conference, I see, okay, this is one thing that we need transparency, and the second thing is, and scientific freedom, but the second thing is, hearing your case, this is an actual case that has harmed, that's covering up all those scientific findings, or doing bad science, can kill people even. So how do you think about that?
Well, I will say one of the best ways to get through what we do or finding out harms is we have to have lawsuits, because in litigation you get documents out from under seal that show that the companies have known about the risks. And they have known about the risk of suicide, and it's really hard when you see in black and white the documents that show that they've known, and my husband's dead and countless of others are dead. So this is a huge part of advocacy, is that we have the ability to hold companies accountability, because lawsuits are about transparency and accountability.
Okay, and so a last question I was thinking, because you say they're knowingly conceal the evidence, basically, and they know about this. So have you thought about the people actually doing this? Yeah, that must be horrifying that you realize this.
Well, it's really hard to, obviously you can understand why a company would want to keep their documents under seal. But for judges, and I think that is actually criminal, because if there's public health consequences, these documents need to be made public. And so there will always be the company side and the political side and lawyers trying to, keep it from being public, but it belongs to the public.
Thank you. Yeah, and the justice system should be the justice system again, maybe also.
Yeah, the justice system needs to do what it was designed to do, which is hold both sides. It's what keeps the system telling the truth.
Thank you very much, and good luck.
And I'll leave you with this, my favorite quote: "A nation that is afraid to let its people judge the truth and falsehood in an open market is a nation that is afraid of its people." And that's by John F. Kennedy. So, anyway, I know